I hope everybody joins in early so that we have a lot of questions to be answered. So let us start with you must have seen one of the case today I've posted of MacFoss. There was a case of a lady, one of my camps. She was doing that stitching work. She had a lot of pain in the joints, in the muscles, in the calves, in the hands, lot of cramps and all. And she suffered from a lot of pain, and she was on painkillers and calcium tablets, but that was not helping her. She had a very typical symptom whenever she used to sit on the machine, the sewing machine. She used to get cramps in the hands and cramps in the calf muscles. So there's a very beautiful remedy in our mathematical where it is written that cramps in the calf muscles, especially of tailors, or cramps on the hands while playing piano, cramps in the hands while playing a violin. So in that context, I had prescribed that remedy, and that has given me a very good results. Today only I have posted the case. I hope everybody has seen that case. This is, I think, my 36th case which I've posted in the past 1.5 months. So do see that case. It's a fantastic case and a very simple remedy. I know everybody would have guessed the remedy, but just because I've got a good cure, so I have put that case. Yeah, good afternoon, Dr. Anja Smith. Hello, Dr. Babel. So do see that case because the cramps in the hands, like playing a violin or a piano, cramps in the claves, like Taylor. These symptoms are very common in those conditions where people are working and burning the candle at both the ends. In that remedy, can anybody tell me the remedy which I prescribed? If you have seen the case, anybody? Which remedy I prescribed? Yeah, so I hope you have got the remedy was very easy, but sometimes what happens that we try to make a lot of themes and a lot of mental understanding of a particular case, and that remedy does not come because sometimes it does not match with the theme. So I believe in simple homeopathy, simple symptoms, simple prescriptions with very good results. So which is the remedy? Anybody who has seen the case? Yeah. I think nobody has seen that case. So do think about that remedy, and it's a very interesting remedy. Anybody who has seen that case today? There are already few doctors online. Or if I ask you the other questions, cramps in the calf muscles, not in the case, cramps in the calf muscles, especially tailors. Which remedy comes to your mind? Cramps in the calf muscles, especially tailors. Which remedy comes to your mind? Good afternoon, Dr. Baba. Cramps in the calf muscles, or you can say cramps in the hands while playing a piano, or cramps in the hands while playing a violin. Which remedy comes to your mind? That's very important. And that was the remedy which I prescribed. She was not a violin player or a guitar player or a piano player, but the symptoms were that way. So don't wait for the patient to tell that while playing a guitar or playing a piano, I have a problem. So it will not work. So you have to sometimes apply your mind and think of something which is written in the books and then correlate in the clinical practice, and that would give you good results. So the remedy prescribed was, I think you better read that case and then we'll come to the remedy. Good afternoon, Dr. Alexander. So let us discuss some other questions. So one more question that was there today there are a lot of questions, but there was a typical question where the patient told me that the doctor told me that he has a case where when the patient starts talking, he suddenly starts talking as if he is not talking on the main subject and he starts talking something else only. So is there any rubric or is there any medicine for that? Just one line, and he wanted the medicine. So I had prescribed the remedy. I told him the remedy. I just asked him one question, that do ask that lady that why this is happening. So Dr. Robin says lachesis. Okay. There are other remedies also. So do ask that lady why she's behaving in such a way. So he gave me some input that there was a lot of stress in the family, and his husband was doing a business, and that really went bad, and now she's like this type of so lachesis, and yes, jumping from one subject to another. Macphos Jyoti Vaishnav. Yeah, so Macphos basically is the remedy of the case which I had prescribed. That's nice. So this is a very typical symptom that the doctor had asked me. Again, listen. The doctor had told me that the patient, while the lady, while case taking, just starts speaking something absolutely different from her chief complaints, and I feel, what is she telling? Is there a remedy for that? So I asked him, I asked the doctor to ask that lady why she's behaving such a way. And she told that there's a lot of stress in the family, or financial stress. His husband was there in the business, and because of the COVID, the whole business was stopped, and there was they are literally helpless, and they can't think what to do. So this was basically the case. So what comes to our mind? First remedy is lachesis, and the answer is just jumping from one subject to another. Can you think of something else? Then I'll tell the remedy. First of all, you have to understand what is the patient talking and which type of symptom that I have to take for prescription, and then we'll tell the remedy what I have prescribed to the patient, and the patient came out very beautifully with that remedy. And that remedy, in fact, I have told you a few times in my practice also, in my YouTube or Google Meet also. It's a very important remedy, and a lot of times we fail to appreciate the importance of that remedy, but you have to remember that remedy. So one, we have got lachesis. Anything else? First of all, how will you interpret that symptom? That is important. What is the patient telling you, and how will you interpret that symptom? Then we'll see the remedy. First, at least see the interpretation of that, what the patient is telling, and then we'll go to the remedy, which I prescribe, and the cause why the patient is behaving such a way. Anybody? Every time you ask the question, today I'm asking the question. It's a very interesting case. So if you are not able to answer, at least write so that I can go further and give the remedy and the rubric. So I basically the symptom is that patient becomes absent mind. More information. This was the only information which I got from that doctor. So I just took one symptom for that the patient becomes absent-minded when talking. First symptom. Second, there was a lot of stress because the business has stopped, failed, and because of that the patient was behaving such a way. So I just took two rubrics for prescription, or two symptoms for prescription. One symptom was absent-minded while talking, and second symptom, as I always tell you with that remedy, elements from sleeplessness, restlessness due to worry, grief, loss of property, loss of reputation, from business embarrassment. I took only two symptoms for prescription, and of course everybody knows that remedy. That remedy is Calibrom. So I prescribed Calibrom 1M, and the patient came out beautifully with that remedy. Everything was solved with the Calibrom 1M. So this is how basically in lachesis the jumping of topic, the topic is because of the gray matter. The patient is very intellectual. So basically that's why she jumps from one topic to another. That's lachesis. This was Calibrom. And if you see the rubric also, that absent-minded while talking is also Calibrom. Elements from business embarrassment, loss of property, loss of reputation is also Calibrom. So both symptoms prescribed, clubbed together, repetized, the remedy is Calibrom. And I think Calibrom, I've told you many of times in many of my webinars. It is a remedy which basically is not used as frequently it has to be used. There's one sentence in Calibrom that you should always remember. Feels as if they would lose their mind. That is Calibrom. A very small sentence, but carries a big weightage in a practice. Big weightage. Feels as if they would lose their mind. Now, if this one symptom covers everything, sometimes it is a summary of the case. This is a summary of the case. That is Calibrom. So we gave Calibrom 1M, and let's move forward to another question. I hope you got the answer. Calibrom, everybody. Short case, short results, whatever I could see in that case. Okay, so let's move forward. Do you have some questions, or I'll see some questions from the WhatsApp? Yeah, so there was one more case, and this was again an interesting case, and again interesting symptom which the doctor asked me. Now there was a fantastic case. There was a girl. Calcarea carb has that too. No, Calcarea carb is not absent-minded while talking. It is not. But of course, Calcarea carb definitely has other symptoms, but it's not absent-minded while talking. I prescribed Calibrom, and it was a particular symptom that husband business was lost, the reputation was lost, everything was lost because of the COVID situation, and it started because of that. So there was one. Again, I'll discuss a beautiful case. I'll insane. Yeah, that is present in a lot of remedies. Of course, you're talking about that, so Calcutta carb is there. So one more case. There was a case of a young girl at 4 years of age, and she used to pass stools only on the pamper, only in the pamper. She did not like to go in the bathroom. She did not like to go in the bathroom. And the history was that the girl basically was always playing with her toys, with cars, or painting and drawing. That was only complaints because the patient had already taken a lot of homeopathy and allopathy medicines. So this was only symptom available to me, and I asked that what does that girl do the whole day, and they said that she is always playing. Sir, give her some toys and cars, and she's always playing, talking on the phone like dummy, and she's always busy on herself. We don't have to worry that what she's doing. She's always busy. Or some painting. Her painting is also good. She draws very nice. And these were the symptoms of that girl. And the main concern was that the patient did not pass stools in the potty seat. She used to pass in the pamper stand, like hiding and then passing stools, and then used to used to again. And the other symptom was that she was like very much closed and very much close to her mother, always with the mother. That's like that. So these were the symptoms, and we prescribed the remedy, and she came out very beautifully. Now, only 3 days back, I came to know that she's passing stools going in the potty. Okay. So, yeah, Dr. Meera, Abyss nigra. Yeah, it was a fantastic, it's a good remedy, and I've cured a lot of cases with Abyss nigra. So this is my YouTube channel. Do watch that channel, because I basically, whenever I speak some remedy on that YouTube channel, I speak only what I have seen in my result, what cases I've cured in my practice. So it's basically all clinical, though it must have some base of mathematical, but those are all clinical symptoms and clinical disease which I've cured. So do look into that channel, and every time when I upload a video, it's basically if I've cured that case, I upload that video. Okay. So stools only in pamper, child needs to be secretive in private. Yeah. As I always tell you, if you ask me, Dr. Lisa, first of all, I basically see the very easy part in homeopathy, what is there, and then start to prescribe, rather than, I know, very private, and you can take that secretive and all, but I didn't take that. I did not take that for prescription. The only 3-4 symptom which I had, because the patient was on the phone. She's very close to her mother, always wants mother around. And if the mother is working in the kitchen, she's happy, she's playing with the toys, no need to get disturbed. She can play for hours together. She can keep talking on the phone, dummy type, or coloring, or anything, or playing with the toys, cars, everything. And these were the symptoms only. And she's only 4 years old. She's only 4 years old. So I did not take that rubric secretive and private. So I welcome Dr. Meera, Dr. Prajapati, chronic constipation, clogged stuff in years of 3 weeks, child. Yeah, I'll give you the answer. But if we are on that case, we'll first finish that case. So that is a fantastic case. 2 days before only, I just got a call from her that now she's going in the stools and sitting on the potty and passing stools. This is the beauty of homeopathy, Only 4 years age. So can you think of some prescription? A beautiful child, a soric child. You can see a beautiful laugh, very sober, everything good about the child. So can you think of something else? See basically, just apply a simple rubrics and you'll get the remedy. In the meanwhile, I'll just take one question. Chronic constipation, clogged stuffed in ears for 3 weeks. In child, loss of hearing, aggravation morning. Now, see what happens if there is loss of hearing, okay? And you have written specifically, Dr. Lisa. Now, see, this is a very good case thing, Whenever somebody asks me like cons in homeopathy. Now, cons in homeopathy, if you ask me now, there are remedies and remedies. Or you can say what's remedies and remedies. Now you have specifically asked, in the morning when the patient wakes up, there is diminished hearing or loss of hearing. Second, chronic constipation. So when you see this is a particular, this becomes syphilitic, loss of, he cannot hear, syphilitic symptom. So that gets more importance, especially in the morning. The first remedy that should come in your mind is the only one remedy, and that is sternum metallicum. Sternum congestion, chronic congestion, sternum metallicum. In the ears, sternum metallicum. When the patient has a weakness or diminished or loss of hearing, especially when waking in the morning, a syphilitic symptom in a child, you have to think about sternum metallicum. Okay, now sternum metallicum, if you see in the Mater Medica, it's a beautiful remedy. I'll tell you the basic Mater Medica. Extreme exhaustion of mind and body. Extreme exhaustion of mind and body. Sora, psychosis, congestion and syphilis, loss of hearing. So there is a lot of congestion, that means psychosis is there, and the related symptom of syphilis, cannot hear properly. Exhaustion, both mind and body. That is sternum metallicum. Up till now, we only thought that sternum worked for chest complaint, great weakness of the chest. The patient is not able to talk because of weakness of chest, and the cough is very deep, very hollow, and that there is cough in 3 paroxysm. That is Muxol. But this is again a very, very important symptom of Muxol. Loss of hearing, especially in the morning while rising, extreme exhaustion of mind and the body. So do think about this remedy for your case, sternum metallicum. Okay. So let us go any further. Abis Nigara, I hope, Dr. Meera, you use that remedy in your practice, and then maybe it will be happy for me that whatever I'm speaking is working. Okay. So next we again go to the next question, or the answer for the child, the case taking of the child. Which remedy you think I would have prescribed and the child is out of it? Mind you, the child is not from Nagpur, very far from here, about I think 1500 kilometers from Nagpur. Taken a lot of homeopathy treatment, allopathy, nothing has worked. But at one dose of that medicine and the child is out of it. So do think homeopathy sometimes very easily rather than taking that implied symptoms. So can you guess some remedies, or we have one more question? Do keep reading about the cases which I sent, because those cases were acute. I have seen that I practice and have some very unique symptoms which I have seen in that remedy, which we never think of, and then we prescribe the remedy. So do think about those remedies also. In my, I think my assistants are writing that in the name of OPD diaries. So do take note of that case. Those cases are not exactly perfect cases, but I just wanted to highlight some symptoms of the common remedies which we normally fail to appreciate and understand, and that's why we miss the remedy. One more question. Total anosmia since 4 years after smelling strong ammoniacal chemical. Yeah, so this is basically, see, there is always an exciting cause for a particular disease. After strong smell, this is very important. So whenever the person comes to you that after a strong smell, after some strong, the patient suffers from anosmia. Now, of course, don't start giving ammonium carb or ammonium mu or ammonium sulf because it was because of ammonia. This happens because of the strong smell, it affects the nerves. Remember that, Dr. Joshi. It affects the nerve, and because of that, the nerves goes in transient paralysis. And that's why the patient suffers from anosmia. A very wonderful remedy, 2 or 3 remedies that I have used in my practice in these type of complaints. First in the list is Naxomica. Second in the list is Hyoscyamus. And third in the list is opium. These 3 remedies are very, very important that I have used in my practice and have got good results in cases where the smell is lost or the smell is wanting because of some strong smell that has caused a trauma in the nerves of the nose. So do think about these 3, 4 remedies and you'll get the result. Okay. Okay. Some more questions and fast. Can you talk a bit of remedies for sepsis with Petici? Yeah, see, first of all, as I always say that having knowledge is something very different, and basically you get a chance to use that knowledge is very important. This condition of sepsis or ecchymosis basically will come in cases where the patient is admitted in the ICU. And it is so important in this case that you give a result, because apart from homeopathy, there is no other choice. And in these cases, that's why you have to learn how to prescribe in these cases. For example, do remember for ecchymosis and Petici, 1 or 2 things very important. The cause. Of course, the cause sometimes becomes not important because in homeopathy we see the symptoms first, but in this case cause is important because then we can differentiate between miasms. So first of all, ecchymosis or Petici comes, you have to think about few remedies. The first remedy that you should think about is phosphorus. The second remedy you should think about is hemamalis, arnica, and surgery fail, broke fibula. Okay. So we have, so of course, when I started with phosphorus, then I told hemamalis and arnica. In this case, I'll go first with arnica, second with phosphorus, and third with hemamalis. And there are few remedies which basically are sometimes not thought of, but has given me good results. Sometimes what happens, the whole constitution is very slow and sluggish. Sometimes the constitution is very slow and sluggish. In that case, 2 remedies you must think about. The first remedy, carboveg. Very important remedies for Petici ecchymosis, carboveg. When the constitution is slow, but in carboveg, the disease or the symptom originate very gradually. And one snake remedy. Now you'll be surprised that I have not used lachesis so much in these cases, but instead I have used Crotalus horridus in these type of cases. And Crotalus basically has a very interesting symptom. That the disease are caused by a previous low state of the system. It's a very easy, it's a very generalized line. Disease is caused by a previous low state of the system, like low septic typhoid or malaria, alcoholism, where the vital force is exhausted and there is a genuine collapse. The word, see the beauty of a mathematica. See the wordings, a genuine collapse. A genuine collapse, exhausted, previously low state of system. That's why sometimes what happens, we miss out Crotalus horridus and give carboveg because we feel that the symptoms are slowly coming. But in Crotalus horridus, it is written in a mathematica, disease caused by previous low state of system, like septic typhoid, like malarial fevers, vital force exhausted, and a genuine collapse. So do think about these remedies. I hope, in short, I could answer your question. Can you talk? Okay, disoriented for a long time after epileptic seizures and restlessness. So disoriented after convulsions. Actually, first of all, let me ask you, how many cases of epilepsy or convulsions we can cure in homeopathy? That is very important, And I can give you a very positive results that there are lots and lots of cases which have been not treated but cured of convulsions with homeopathy. But if the patient is disoriented, after attack, Then you have to ask the patient a bit of a particular symptom disoriented in relation to what. Sometimes what happens, I had a case where the patient used to tell after the attack of convulsions, epilepsy, that he used to sleep and say, I have to go to the office. Please call the car. I have to go to the office. In spite of he being in the office. That is one type of disorientation. So you have to define that disorientation. As I always tell you, if you define that disorientation, automatically everything would come to normal. But as you have asked the remedies, I'll tell you some of the remedies. But I would be happy if there are symptoms which are very close to disoriented, and then it would be an important remedy to prescribe, and the remedy will give you good results because you are very you have to taken a very specific symptom and you have taken a very peculiar symptom for that disorientation. Of course, you can write the remedies. The first remedy should be disoriented where he was. So this is what basically we want, where he was, or he wants to go to the office, he wants to go home. Ask the patient that time what he wants to do in that disease state. So whether he wants to go to the office, whether he wants to go to home, whether he wants to talk to his children, to his father, to mother, that is very important, you know. So the remedy you have to write, Dr. Anja, that is, first think about hyoscyamus, second think about plumbum metallicum, third think about causticum, and fourth think about lachesis. Disoriented. Okay, sir, can you please tell us the remedy prescribed to that girl for stools passed in diarrhea? Yeah. So I was expecting some of the answers, even if wrong. Dr. Disha, can you first of all, don't give me the remedy. Give me basically what symptom will you take for prescription. That is important. What symptom will you take for prescription? Don't have that ideas of making again themes of remedies and going deep inside and then understanding the theme and then prescribing. Don't do that. Whatever the patient has told you, if you can make a proper mathematical symptom, your knowledge of mathematics has to be a little bit better so that it is very easy to prescribe, you know. Development slow in the girl. No, I told you she's a fantastic girl. She's working. She's basically not troubling the mother if she's at home. She's playing with her toys. She's playing with her phone. She's just talking on the phone to somebody XYZ, and she's absolutely busy with her. And sometimes the mother does not come to know also whether she's she's so nice and she's playing so much. So this is something very peculiar, you know. Want someone, no, yeah, she, as I told you, she always wants the mother. She always wants the mother. So that is important. So if in fact, you know, also you posted a group about burning, yeah, morphinum. Yeah, so sometimes what happens, Dr. Mira, sometimes what happens, you know, that we prescribe a lot of remedies, and it does not get relief. And then basically some things the patient tells you after 3-4 visits that yesterday I had a very burning saliva, the saliva was so hot, and immediately we come to a mind, oh, this is the most striking feature, the striking symptom, the syphilitic symptom in the body, and then you try to search the mater medica. But you must actually know that you have read this symptom somewhere so that you can, that it strikes you. Then you can turn the pages of mater medica and come back to the remedy. So this was a fantastic case of morphinum, you know, morphinum, where the patient was suffering. I don't know exactly. I think the lady was suffering from, I don't know. I'll check the case, but this was a very important symptom which I prescribed morphinum for burning saliva. So do ask that these symptoms, you know, this will definitely guide you to the remedy. This is how the case taking should be, you know. Otherwise, you go to morphinum, it is a narcotic, and then you make a theme of that they're very sad sometime and they're very hilarious sometime, like opium, so very close to morphinum, and you'll be so confused what to prescribe. You can never prescribe. But if your mathematic is a bit slight better than normal, you know that this is symptom of morphinum and you can prescribe the remedy. Chili makes me think of pulsatilla. Okay. So I'll tell you which symptom I took for prescription first. A 4-year-old child sitting in a room, playing cards, talking anonymously to somebody on the phone, playing with cars, playing with toys, not disturbing anything. If somebody passes from the room also, it hardly matters to her. She is playing with her. The first symptom I took for prescription is absorbed. My dear friends, the first symptom I took was absorbed. And the second symptom I took for prescription, second, was clinging to the mother always. And third symptom, a beautiful soric child, lean thin, always happy. I prescribed the patient a single dose of phosphorus 30. A single dose of phosphorus 30, and the patient came out within 2 days. I told you just 2 days back I had a telephone and she's passing stools normally. This is the beauty of homeopathy. This is the, I would say, this is the beauty of simple homeopathy and simple interpretation, as I always tell to my students and followers. Of course, there are other cases where you have to think differently, but this was very simple. With phosphorus, the patient came out. When summer comes, hands and feet feel like intense burning. So I hope, Dr. Disha, you got the answer for that. Phosphorus 30, and see, Mathematical wise, we know phosphorus so many symptoms. You know, you just open one YouTube channel of homeopathy and there will be about hundreds of phosphorus, and we are so happy that phosphorus is a beautiful child and XYZ, XYZ. But now, I have a booking now. Yeah, do. Okay. So we have, I hope you understood, Dr. Disha, the case phosphorus. It was a fantastic case of phosphorus. I was telling you, in YouTube, there are a lot of phosphorus. You know, we make themes and we make pictures, and in the patient, sometimes we don't see. So clinical, clinical is so important to understand that clinically, if you know, if you have seen phosphorus, those 3-4 symptoms, and you can get the remedy. So again, one burning of the palms and soles, intense in summer. Now, okay, if it is burning in the palms and soles in winter also and in summers more. So if you ask me, basically, if you give the remedy and the burning is better, I don't know it would happen or not, because it is a constitutional state. So it's a constitutional state. Of course, if it is out of control burning, it is so much burning that it is disturbing the normal routine of the patient, it is disturbing the working of the patient, then you may think about prescribing a remedy. But this is a constitutional state. Maybe sometimes if he suffers from a disease, of a pseudocytotic disease, then this symptom will come into this importance. But the remedy that you should think about, dry heat, this is called, as in summer especially. Think about ferrum first. Think about a very, very interesting remedy. I don't know whether you have used or not. Arsenic metallicum. Arsenic metallicum. Write down. These 2-3 remedies I have found useful, and the third remedy that you should think about is Gadus morua. Gadus morua. Gadus morua. Morrhua. It is prepared from codfish. So ferrum first, China ars, arsenic metallicum, and Goddess moria. This is the remedies which you should think about. So one more question, sir. Did you mention of remedies of urticaria which is very sensitive to touch? The network was poor. Kindly mention if already discussed. Yeah, this I had told you in the last webinar, no? Anybody can give the answer? Urticaria, very sensitive to touch. We had done this basically in the previous webinar. Anybody? Urticaria very sensitive to touch. You touch and the patient has a lot of pain, you know. Can we think of the remedies? No, you have asked the question, so we don't. Anacardium. Achha, I have not told the remedies. Okay, so we have got the remedy. Anacardium. Okay. Anything else? Arnica. Okay. Anything else? I thought that I have told this in a webinar, but I don't remember in which webinar I have taken, because there are so many webinars going on. Arnica montana, Naxomica. Okay. As I told you, I think in the last YouTube, that urticaria basically is very easy to treat. Just see the cause, just see how does it appear, and just see that how does it get better. These 3-4 things, if you basically are very, very well versed with, and it will give you good results. So this is important in urticaria. Of course, soreness is there. If you ask me a symptom, I'll tell you the answer. But this is very important, So we have a lot of remedies: Pulsatilla, Naxomica, Arnica. Yeah, there. Any other remedy that you can think about? Yes, anybody? Any other remedy? Urticaria, hives, and very sensitive. And sometimes the sensitiveness is so high that the patient cannot bear it, so he has to take immediately. Yeah, bathing aggravation is boista, but there's a very specific question from the doctor that it is sensitiveness is important. You know, now, now I'll basically just go one step forward and tell you the sensitiveness first. If it is on the skin, that means it has to be on the mind. It has to be on the mind also. So first consider that is so important. So what remedy now comes to your mind? Tell me. Of course, I'll tell you both the remedies. Don't worry, I'll tell you both the remedies. But I want you all to appreciate that part of homeopathy also. If the sensitiveness is there, then do think about something of the mind also. Whenever the patient gets urticaria because of sensitiveness of the mind, staphylococcus. No, that is the beauty of homeopathy. It is not staphylococcus. I'll tell you one answer. You have asked me, Dr. Sangma, sensitive to touch, the patient touches and there is a lot of pain. The remedy is Hipar sulf. The only remedy is Hipar sulf. But you know what will happen? You know what will happen? That if you cure one case of Hipar sulf with that urticaria and you're practicing for 20 years, you're seeing so many patients per day, and every time the patient is coming with that urticaria with very painful sensitive, then you start thinking it is not Hipar sulf is not working in all the cases. And then you give that answer. Okay. So for emotions, sensitiveness of the emotions, I just got this answer from from one of the doctor to anacardium. Now anacardium is a wonderful remedy where the urticaria is basically is sensitive to any emotions. That is important, anacardium. But before anacardium, you think about natramur. First is natramur, second is anacardium. And mind you, I told you one remedy. I think it keeps coming again. When the patient when he suffered from that, he had bought some property and that property basically he came to know that he was in litigation. It was in litigation, and because of that he could not control the emotions, and he got severe urticaria in the whole body. He started itching, and with no medicines he was getting better. But with our dose, that one dose of the medicine, and the patient was out of it. Again, I took only one symptom for prescription: urticaria from emotions. And that one dose, which is that remedy which I gave? Which is the one remedy that I gave? Anybody? Anybody? Natramur. No, I am telling you that the patient had bought a property, but after a few months, he realized that the property was in litigation, and the whole money was blocked, and and after that, got a lot of itching, and then he came to me. I gave the remedy, and the patient was better. Again, elements from loss of reputation, disappointment, business loss, and urticaria from emotions. I gave the remedy Calibrom. See, Calibrom is coming so many times, Calibrom. So this is Calibrom. Yeah, this is the beauty of Calibrom. So sometimes if you get time, if you take case and you get these symptoms, I always tell you, think about Calibrom. See, don't only give Calibrom for one condition. Calibrom is basically given for which condition? Anybody? When we think Calibrom, yes, anybody? When we think of Calibrom is used in so many conditions, but as a doctor, as a practitioner who has just started the practice, we basically, So Dr. Palaksi, we give Calibrom only for pimples. And it works also. I'm not telling that. It works also. But Calibrom is such a fantastic remedy. Just one dose of Calibrom, urticaria because of business loss and from emotions, and Calibrom cured that case. So this is, I hope you got that about the urticaria, soreness, hyperacel, then anacardium, natrum mure, Calibrom are the remedies for emotional. I would give more importance to urticaria from emotional cause rather than the physical cause. Okay. So let us go further. Some more remedies, some more questions. Yeah, everybody was right. Stammering case also. Yeah, Calibro. About sister scan. Yeah, Dr. Chatterjee, as I always tell you, sister scan I have already spoken on my YouTube channel. So please go to that YouTube channel and first hear that sister scan, what I've taught basically in that, and then you can get back to me. Okay. 67 years old patient recently diagnosed diabetes after allopathic treatment for gastric ulcer. Before 2 months, patient was all right. All test was normal. When he gone for cataract surgery, please guide us. Now see, whenever a case comes to you of diabetes mellitus, it may not be always because of allopathic treatment, or gastric ulcer treatment. Diabetes takes a very long time to develop in our body. So in this case, a very important symptom that you have to ask to the patient in diabetes, that this is what I have seen in my practice till date. Patient basically are not happy. Patient, now remember and hear everybody very, very carefully. First I'll tell in English and then I'll tell in Hindi. Sometimes the patient has everything in life, but he cannot enjoy. That's why diabetes develops. That is what I have seen in my practice. अगेन आई होप, मतलब पेशेंट के पास लाइफ में सब कुछ है बट वो लाइफ एंजॉय नहीं कर सकता. उन केसेस में मैंने देखा है डायबिटीज ज्यादा पाया जाता है. सो डॉक्टर कौस्तुभ, if you understand this and if you do the case taking in these conditions, you'll be able to have very good results in diabetes also. Sir, what about urticaria with excessive burning or heat regularly at night? Now see, if you basically are prescribing for urticaria, now remember one thing in urticaria. Urticaria sometimes is basically, in fact, if you're asking me burning or heat at night. Now if you're prescribing it for urticaria and there's a lot of heat and a lot of burning, especially in the night, do think about remedies like sulfur, semisefuga, kali carb and pulsatilla. Okay. Calibrom, face swelling on lips on inner side started 2 years ago. Age 18 years, swelling of face, especially on the lips of inner side started to. Now, basically, what is, you have to ask to that patient, Dr. Sachdeva, swelling means what swelling? Whether it is ranula or how did that swelling occur? If there's swelling on the lower lips, how did that swelling occur? And how is the swelling? You have to, if you have only one symptom, a psychotic symptom, then you have to define that psychotic symptom. That's I always tell you, define that psychotic symptom. Just simple swelling in the lips, I'll tell you some of the remedies, but I will not be happy because it's a very generalized question. That's why you may get results, you may not get the results. In cases where the swelling is generalized and there is no other symptom, but there has to be some symptom, it is not possible that there is no symptom. Still, if you're asking me some remedies, then you can write some remedies like, you can think about bryonia, you can think about natrum mure, you can think about lachesis. In fact, I'll tell you the opposite part of that. If it appears very shriveled, then the remedy would be like what you call or a muraticum or a mure, antimtat and chimaphila. Chimaphila I have used in the opposite condition when the lips are very shriveled. So both conditions you can think about the remedies. It occurs in the morning. Yeah, you can, so this is the remedy which you think about. You can add to natrum mure one remedy, and that is natrum carb also. Sir, for managing diabetes, can we start with mother tincture or constitutional medicine as patient always demands quick action? Yeah, mother tinctures definitely will give you very good physiological results. I would not say don't use mother tinctures. Sometimes what happens, the patient is only on homeopathy treatment and suddenly the sugar goes, the patient goes out and he has no medicines and he feels know what to do. In that case also, to at least a supportive action is important. Second, sometimes what happens is the patient says that give me some remedy so that the sugar, if it goes up, I can basically give this, start the remedy so that it comes down immediately. In those cases, you can use some other tinctures. We have Cesium jumbolinum, we have Gymnema, we have Tinospora, we have Abroma augusta. These are remedies which you can use, and they definitely have some physical action, but don't make it a habit of using it continuously, because use it for a few days and then you shift the patient on the constitutional treatment and give that SOS if it is required. Loss of sensation, that is Calibrom also. Caliphos nitric acid. In two patients, Parkinson appears after corona vaccination, but no signs in the brain, CT, MRI. Tremor typically type of walking. Yeah, normally in Parkinson's, brain scans are basically normal in the initial stages, but if you have a classical case after vaccination, then you must think about a generalized remedy. Don't think about soranum or carbovage or that remedy. Then a general remedy, vaccininum. And to be more specific, if you can get the remedy from that COVID vaccine which was given, you can put on as COVID vaccination, then also it would be good, and that would be like tautopathy. So that also you can try. Lady with excessive sweating in the underarms with no smell. Yeah, this is basically, I have also a lot of cases with that. And it sometimes it works and sometimes it does not work also. So I'll be very frank. Sometimes it can and sometimes it will not. It may not work. So in this case, just take the whole case. Just see the constitutional remedy and prescribe, rather than having that remedy which are there in the metribuzin remedy, but that has not given me so result. So basically, you take the case taking and then you can prescribe the remedy. So rosacea case, itching, hot, red, swollen on nose, cheeks, pustules filled with amber fluid, aggravation right side, aggravation PM, etiology stress, antium given, conditions 50% better but not cure advice. Acne and all these cases are such difficult cases to treat, because the patient, you can see your, it's an exam for you can see what is the results on the face also. So in these cases, 2-3 things which I have seen in my practice, I'll just share with you. In these cases, first remedy that you should think about is Carbo animalis. Second, Calcarea silicata. And third, you must read and think about soranum. Very, very important remedy, very, very interesting remedy. I have got very good results in lot of cases with soranum. Sir, 45 prostate said normal, urine report normal, no UTI, no diabetes, frequent urination, night 5 to 6 times, daytimes income urination, unsatisfactory. Started flow urine good, then starts dribbling when never ends for last 4 years. Many medicine tried. Okay. So just for increased urination. See, first of all, you have to understand if it is basically elimination. It's elimination. But it is basically increased urine, because increased urination. Normally, if there is elimination, so just make sure that it does not trouble the patient. That is important. Means you can think, of course, I don't know which remedies you must have given, but in these cases, there are few remedies that are very, very important and very, very interesting to think about. The first remedy that you should think about in these cases is what I in my practice, Kali nitricum. First. Second, nitric acid. Third, phosphoric acid. And fourth, again, now this is a remedy which basically I have used sometimes in these cases, and that is codinum. CODEINUM, codinum purpura. These 4 remedies have given me good results. Because if there are no symptoms, you cannot think of berberis or cantharis or terebinthina or petroselenium or hydrastis or prunus. There is no symptom. So these 4 remedies which I have got very good results in my practice. The swelling is more in the morning and it reduces after brushing, feeling of pulsation in, yeah. Acha, we on that question only. Okay, swelling is in the morning. So make sure that it is not a ranula. No, make sure that it is not a ranula. And in these cases, I whatever remedies which I can get in is first think about thuja. First think about thuja. Second, think about naxomita. And third, think about Sambucus nigra. Asthma and dyspnea develop after first vaccination. Remedy may be thuja. हाँ मिस्टर जी, आप थूजा सोच सकते हैं, रेमेडी थूजा हो सकती है वैक्सीनेशन के अगर बाद आया तो। और आपने देखा होगा बहुत सारे सिम्टम आजकल तो लोगों के कोलेस्ट्रॉल जब आते हैं ना 300-400 रहते हैं और बच्चों का चिल्ड्रंस बेसिकली आफ्टर 20-25 years आफ्टर दिस कोलेस्ट्रॉल इज गोइंग हाई एंड दैट डी डाइमर्स आर वेरी हाई, lot of dyspnea and lot of heart blocks are there. So in these cases you have to be very alert and understand what is the patient presenting to us. Thuja can be used, the COVID-19 nosot can be used, antimicrote can be used, sorinum can be used, carbovec can be used, so the vaccinum can be used. See, vaccinum is a generalized medicine basically, but if you could procure that vaccine of COVID and then potentize that, I think that would be a good research work which I have not done. So let's see. But that COVID-19 is working and I have sent you all also. I hope somebody can share the experience if they get results with that nosode which I have sent you. Ikne Rosacea, thank you. Yeah, thank you so much. So are we done with all the questions or some things are remaining? Yeah, so you can, Dr. Samma has asked, compare some remedies, now you can take a simple rubric. I know, you start first of all going to a simple rubric that the patient has perspiration which is profuse. Second, you can think about perspiration is in profuse in the axilla at what time, in the morning, in the night, while working or going out. There are a lot of other symptoms. And then how is the perspiration, whether it is blend, it is acrid, it is staining. Gradually if you go, you will get sometimes a very good result. So you can see whether the perspiration is debilitating the patient. So we have rubrics for that also, debilitating perspiration, like China sulf is there, syphilinum is there, or sometimes the patient has perspiration after acute disease, then we have I think pilocarpus is there. So then try to evaluate the perspiration, the modality, and then you can prescribe that constitutionally. Yeah, Dr. Sama, you please ask can we make a group of bankers, CA remedies, mentally calculative, doctor, engineer remedy according to their mind? Yeah, why not? You can definitely make, because as your practice increases, as the number of patients increases, then you have to find some way to get to the remedy. You can definitely do it, that intellectuals. Then there are, for example, if you take a CA, how is good in CA, whether he's good in giving taxes or he's good in hiding the money, or there are a lot of other, depending on what he's shrewd, he's manipulative, witty. So these are the rubrics that can come to any professional, whether it's CA, doctor or a lawyer. So think about that rubric, that witty, the manipulativeness, the deceitfulness. Okay. Yeah, it's already there, but then see, if you ask me, it's very important that clinically what you are finding is more important than everything what is written in the matter medic, or in the repertory. Clinical, that is, you have seen in that case and you have seen that type of personalities, so you can make your own clinical observation and then set the remedies right. There are some remedies which I have used which are absolutely not there in the books or in the repertory, but I have got good results. So it is individual. After some time of your practice, you have to be very individualistic and very, very what do you call, unique in your prescribing. You have to develop something of yourself. Everybody is unique, so you are also unique. So that's very important. Okay. Dribbling, the question. Okay, which question? Cracks on the palms. Yeah, so simple. Okay, I'll first finish that question of perspiration. So if you have perspiration which is too much, which is dribbling, and the affected part is always wet, it is said that. So you can think of, you can write the remedies: Cilicia, veratrum, sulfur, sambucus, phosphorus, China. These 6 remedies have got very good results. Okay. Lisa Robbins question. Acne rosacea, no? Acne rosacea question. That's all we through with that, no? Yeah, so I've whatever King Alex. So whatever remedies which I have told, you can use that remedy. The last remedy which was very rare to do is codinum, which is not affecting the patient actually. So you may either prescribe or you may not prescribe. That depends on the patient's uneasy condition. Dribbling is never ending. Yeah, the questions below Lisa Robbins' question. Which question? Acne rosacea. That we are through with that question. No. Anything else? Below that, just a minute. Below that, sweating of underarms we have seen. Then we have the question of prostate size of I think Dr. Alex. If you can write the question again, Dr. Sama, I'll be able to, because it has scrolled up, so I don't know exactly. One question is unanswered is of Devangi Joshi, cracks in the palms. Actually, this is Dr. Joshi, that you have to define the cracks. It will be happy. I'll be happy that if I give the answer, if the question is very precise. Now, cracks. Thanks a lot, Dr. Alex. So, cracks in the hands. In the palm. Sorry. So, cracks in the palms. It's basically a very generalized question, but still, if you have asked me, you can write down. This is the basic remedies for cracks. You can think about the first remedy. Just now it was answered by Cistus canadensis. Second, a very important remedy, petroleum. Third remedy, it is a bowel nosut that you should remember, that is Morgan Pure by Patterson. And fourth remedy that I think you'll be surprised to know that I've used in my practice on the cracks on the palms, Merck Ido Rub. Merck Idatus Ruber. That is the remedy. So, I hope I have answered most of the questions, and it's already 1 hour. So thank you for joining, and do watch my YouTube channel so that some remedies you will be able to appreciate and understand clinically. For example, Sister Scan is there, Abyss nigra is there. So yeah, Morgan Pure, Dr. Lisa, Morgan Pure by Patterson. So everybody, thank you so much. Thank you for joining, and thank you for your time.